Thanks everybody for joining us today. Really appreciate your time. We've got an excellent presentation for you, today's Lunch and Learn. So just so happy to have everyone with us. My name is Allie Orwig. I'm with the Indiana Rural Health Association. And before we get started, I want to run over a couple quick housekeeping items. We are in webinar format today, which means you're not able to unmute yourself immediately to ask questions during the presentation. But I want to draw your attention to a couple ways for you to ask questions. We will hold them till the end, but some of our IRHA staff will help moderate during the presentation. The first way you can reach us is by hovering your mouse over the screen. Some options will pop down either from the top of the screen or the bottom, depending on which view mode you're in. You can use the Q&A or chat function during the presentation to post your questions. Again, we will address those at the end of the Lunch and Learn, but that way we will have them on file. And then the third way is if you would like to verbally ask a question at the end of our presentation, there should be a raise hand function. That way we can manually unmute your line if you would like to verbally ask your question of today's presenter. Other than that, we are recording. We will have this presentation posted by the end of the week to our YouTube channel. If you've not checked our YouTube channel out, highly suggest you look into that. You can just go to YouTube and search Indiana Rural Health or Indiana RHA. We have a lot of good content stored there. And then we will have a quick post-session survey that I will share at the end of today's Lunch and Learn. Literally will take you less than 60 seconds to fill out and really helps us bring this free content to everyone. So we hope you will take the time to fill that out for us. So without further ado, I will go ahead and turn it over to you, Lindsey.
Thank you so much, Allie. I really appreciate it. And I appreciate everyone taking your lunch hour to spend it with me and learn about LifeLine Pilots. So I'm just going to go through a quick presentation about who LifeLine Pilots is, how we help people in your community, and what you can do to really just help us to spread the word about our organization. So our mission, as you can see, is to facilitate free air transportation. And we do that through volunteer pilots for passengers who have medical or humanitarian needs far from home. And that far from home can be anywhere from 100 to 1,000 miles from home. So since 1981, we've been providing free flights. You can see in the picture there on the left of your screen, that's me with our founder, Wanda Whitsett. And Wanda in December actually turns 90 years old, and she still sits on our board of directors. She still participates in the organization. But back in the 80s, Wanda received her pilot's license, and she wanted to find a way to give back to people in need. So she decided to start flying people who needed transplants. And she started asking her friends who were pilots to join in. And from there, the organization grew to really what we are today, 40 years later. We've now flown more than 9,100 flights and more than 6.1 million miles. And we've done all of that with a 100% safety record. So we're based in Peoria, Illinois, but you can see on the map there that we cover 10 states in the Midwest, including Indiana. And we have close to 300 volunteer pilots who serve our organization. So who we help? We provide medical and humanitarian flights. So for those medical flights, we help people who live in rural communities. So those are the communities that you're serving every day. We help people who have a transportation barrier to healthcare. And that's to non-emergency healthcare. We are an organization that doesn't have the ability to provide emergency flights. Ours are flights that are scheduled. They're for appointments and procedures that our passengers can schedule in advance. We need about 3 to 7 days to organize a flight for someone at a minimum. For new passengers, we need at least about a week, just because we have to get a medical release from their physician, and that can take some time. We're here to help people who aren't able to drive for whatever reason, or maybe they can't fly on a commercial airline because of a compromised immune system. And oftentimes the people we help are on a limited income, or they're experiencing financial pressure from ongoing medical concerns. We don't require that our passengers be destitute in order to fly with us. And the reason for that is that we know that when people are experiencing medical issues that are ongoing, it can really drain a family's finances very quickly. And we don't want to add to that burden. So we fly them for free, and we don't require that they show us, their tax returns or any sort of proof of income. Instead, we just ask that they describe to us what their need is. So we also help people who are needing to fly for humanitarian reasons. Oftentimes they're kind of related to a medical flight. This includes flying people who are wanting to be with someone who's dying or someone who has a terminal illness. Parents who want to visit their sick child in a hospital. An organization like St. Jude will fly the child and one parent to St. Jude for treatment. But if the other parent or siblings want to go visit, that's something that they would have to be able to fund, and not everybody can afford that. So that's where they would call us and we would be able to help. We've even spoken with refugee services, human trafficking organizations about how we can help their clients who need long distance transportation. In the top right-hand picture, you see a gentleman, his name's Tim, and he was diagnosed with stage 4 cancer and only given a couple months to live. His family all lived near Minneapolis, Minnesota, and Tim wanted to go home to be with his family before he died. And this was just over a year ago, and it was too dangerous for Tim to fly on a commercial airline because of COVID, and he couldn't sit in a car for that 13-hour ride. So his family drove to Nashville, and Tim and his mom flew with our volunteer pilots while his dad drove the car with Tim's belongings in it. Tim passed away about 6 weeks later, but his family were really grateful to have that time with him. And the bottom left photo is a woman who she was living, her name's Diane, and she was living with dementia about 500 miles from her daughter. And when Diane's son passed away, she needed to be moved closer to her daughter. So LifeLine Pilots flew the daughter to her mother so that the two of them could ride in the ambulance for the 500-mile drive to relocate her. She needed that assistance, and we were happy that we were able to help. Other ways that we help with humanitarian flights are disaster relief. Over the years, we've answered the call to help following many disasters. For example, we took supplies following the Hurricane Katrina in 2005. Our pilots also flew dozens of flights from the Peoria area to Joplin, Missouri during a 2011 devastating tornado. And during the start of the pandemic, you'll see in the very middle there, we helped to fly face shields and face masks to rural communities. Our pilots are flying small aircraft so they can fly into smaller airports. And sometimes during times of disaster, that's really important because the larger airports maybe just aren't available and able to be used. During COVID, we are still available. So if your communities are in need of any supplies that we can help to move, please just reach out. It's something that our pilots enjoy doing. Our pilots love to fly, and so any excuse to get in the air is very important to them. So it's easy for passengers to fly with us. We have an easy to complete online application. We also have experienced mission coordinators, and they make that journey as easy as possible. When a passenger completes our online form, like I said, we have to get a medical release from their physician, and that allows them to fly. This can sometimes take some time, which is why we say that we need about a week for a new passenger. Once we have that physician's release, then they're good to fly with us for a year before we need another one. The great thing about our service is there's no limit to the number of times someone can fly with us. Some people fly once for a second opinion. Others fly once a month for ongoing cancer treatment. Every passenger can bring a companion with them. Adults can bring one support person and kids can bring 2. And the reason that we limit the number of people in the flight is because of the weight limit of the aircraft. Most of our pilots are flying small single engine 4 to 6 seater aircraft. They're private pilots and they own their own planes. And they have a weight limit. The more weight in the cabin, the less fuel they can carry, which means the shorter distance that they can go. So our passengers need to, like I said, have a financial or compelling need. They need to be able to sit upright for the duration of the flight, and they need to be ambulatory. So that's able to get in and out of that aircraft. The reason that they need to be able to sit upright is that most of these planes are not big enough to have a hospital bed or a stretcher in them. So they need to be able to sit in the seat of the aircraft. They get to travel from the airport that's closest to their home and to the airport that's closest to their treatment facility. So they're not having to fly in and out of those large commercial airports. Instead, they're flying out of the small, privately owned airports. Those are often ones that just have 2 or 3 runways. They're called fixed base operators, and every community has them. We have probably thousands in our 10-state region alone. Sometimes the passenger contacts us directly, and other times they're referred by a medical professional or a social worker. And like I said, there's no limit to the number of times a passenger can travel with us. So if they need reoccurring treatment, then they can keep coming back to us again and again. Oftentimes our pilots like that they get to know the passenger. And if they see us send out a plea for a certain person who, if they've flown before, they'll pick that flight up again. There we go. So our volunteer pilots, they donate their time, the aircraft and fuel, and their talent. So last year, our pilots donated just over $1 million in volunteer flights. It's an in-kind donation that they give. They are not reimbursed for those flights. Instead, they take it as a tax-deductible donation, which is fantastic that they can get that. They can have it treated as a donation, and they can help people using a skill that they have. So we're the facilitator between the person in need and the pilot who wants to fly them. These are generally general aviation pilots. They own their own plane, or maybe they belong to a flight club where they share a plane. Some of our pilots will rent an aircraft in order to fly with us. We have one pilot who flies for FedEx, and once or twice a year, he likes to give back, and so he'll rent a plane in order to fly one of our flights. His daughter had cancer about 10 years ago, and during that time, he was having to take off of work in order to help her. And we flew his daughter for treatment. Unfortunately, she passed away, but he likes to still be able to give back to us. So to fill a flight, we use our database of almost 300 volunteer pilots, and they're located throughout our region. Today, using our database and the internet, finding a pilot is a whole lot easier than it was back in 1981 when Wanda started, and she had a home telephone that she had to make phone calls on. Instead of calling the pilots on our database, we have a weekly email that goes out, and it tells them even how efficient the flight would be for them. So if it's within, 50 miles of their home airport, it would show that it was 75% efficient, and they're more likely to take that flight. Pilots accept the flight online, and then our mission coordinators go to work. They're the facilitator. They're the ones that are working between that pilot and the passenger to make the flight happen. We do have some requirements for our pilots. They have to be 21 years old and have 250 hours as pilot in command of an aircraft. They have to pass a medical exam, and as one pilot told me, now this was a year and a half ago, this is pre-COVID, he told me that you have to like hugs, because the passengers, they just want to give thanks to that pilot. They're not paying anything for the flight. In fact, they can't give the pilot any money or any compensation for the flight. It's against FAA regulations. And so the passengers want to do something to say thank you to their pilots. And in the past, it was always that they would give them a great big hug at the end and just say thank you, often with tears streaming down their faces. I really hope that one day we can get back to that, because I know our passengers and our pilots really miss it. So while our region covers 10 states in the Midwest, we're not limited to flying within those 10 states. We work with other volunteer pilot organizations, they're called VPOs, so that we can facilitate missions outside of our primary area of coverage. So you see on the map here, this is where our pilots are. So we have some pilots that are outside of our 10-state region, but if we have passengers who need to travel outside of that region, we work with those other volunteer pilot organizations so that any passenger who contacts us, they get every effort on our part to help them. If by chance we're not able to help them, we like to refer passengers to someone else who can. We have a whole list of different agencies who do similar work to ours, but just in varying degrees. You know, maybe some fly internationally, some fly dogs, or service animals. And so if somebody reaches out to us and we're not able to help them, we really try to refer them to an agency that can. So how the process works, this is probably one of the most important things for you all working in the medical field. When a request is made, it can be done online, or you can also call and talk with our mission coordinators. Oftentimes, that's what people working in the medical field will do. If they have a passenger who they think we might be able to help, the best thing is just to give us a call on our 800 number. You'll see it at the bottom of your screen there. And we can share with you, if we can help your patient. You can explain to us the situation, where they're traveling from and to, and then we can start to figure out a way that we might be able to help them. If we determine that we are able to, and it's something that we think we'd be able to fill, you can go online and you can complete the application for them, or the passenger or a family member can complete it. We will need information like their what they're traveling for, where they're going from and to, who that referring physician is. We also need to know the weight of everyone who's traveling with us, because like I said earlier, the weight inside the aircraft is very important, and we can't fill that flight until we have it, because the pilots will need to know how much weight they'd need to carry to know if they could take that flight. Once our mission coordinators have the information, they fax a physician's release to the referring doctor. Once the doctor gets that back to us, then a call goes out to our pilots with all of those flight details. We are not able to try and fill a flight until we have that physician's release, because we need to know that they're able to fly. Once a pilot accepts the flight, they use our online portal, and then our mission coordinators work to connect the passenger and the pilot, and they oversee the communication that happens. The passenger and pilot decide together what time they're going to fly. If someone needs to fly a long distance, let's say they're going 800 or 900 miles, that means that oftentimes they're going to need more than one flight leg. So we kind of work like a relay system, like a relay race. Pilot number one will pick the passenger up. They'll fly them 300, 350 miles, where they'll meet pilot number two at a predetermined destination. Pilot number two will fly them to another destination where they meet pilot number three, who will fly them the final way. So the further the distance, the more complicated and complex it becomes. But it's something that we can still do, and it's quite a fun experience for the passenger too, being able to fly in this small aircraft, and they get to experience lots of different pilots and different planes. So telling stories is a great way that we share about who we can help and what we do. So I'm going to tell you about a few different people that we've helped here. 3-year-old Talon's actually 4, he just turned 4 now. But he's a frequent flyer. He's flown with us more than 25 times in his short life. And he goes from his home in Kentucky to Boston Children's Hospital. He has congenital heart defects, and he's needed to see the doctor since he was born. And Talon is really thriving now because he's able to get to that medical care. His family live on one income because he's been a very medically fragile child. And his mom needed to be home with him, and so she had to quit her job as a teacher in order to take care of him. She's not able to drive him that long distance because he requires too much medical care while they're traveling for her to be able to drive him, 800 miles. In the middle, you'll see George and his daughter Kelly. So a little over a year ago, we flew them from Minneapolis to Pittsburgh VA Hospital. George needed a kidney transplant, and his daughter Kelly was donating one of her kidneys. And they needed to go to the VA clinic because George was a Vietnam veteran, and that's the only place they could do it. They were told by their doctors that they had to fly privately, and they're newly retired. They didn't have the income for that. And then they did some research and they found LifeLine Pilots, and we were able to fly them It took 3 flights for Kelly and her brother, they flew together, and 3 flights for George and his wife to get to Pittsburgh, and then 3 flights to return. But the surgery was a success, and George is living a great life now because he was able to get that transplant. And then the picture on the right, you'll see this is Tiffany, and we've partnered with an organization out of the Southeast called Angel Flight Soars to get Tiffany from South Carolina to Mayo Clinic in Minnesota. Tiffany needed transportation for heart surgery, and we were able to help her by partnering with other organizations. And it meant that Angel Flight Soars was able to call us, and we were able to fill one of those legs that they weren't able to fill because they don't have pilots in our area. So our goal in talking to you today is really to help us spread the word about this free service. The little guy pictured here, he lives in Indiana with his family. His name's Aiden, and he continues to fight childhood cancer. You'll see that picture on the top right is the most recent picture, and Aiden's really doing incredible because he was able to get to a clinical trial to help fight his neuroblastoma. So Aiden was 2 when his parents contacted LifeLine Pilots, and they desperately wanted to get to the clinical trial. But they didn't know how they were going to make it because it was at Memorial Sloan Kettering Cancer Center in New York. With the help of our generous pilots and by partnering with another organization called Angel Flight East, we were able to help this military family. You know, they were really just trying to stay afloat with all the medical bills coming in and find the best treatment for Aiden. Families like Aiden's hear about us through medical referrals from people like you. They hear about us from parenting blogs online and through family and friends who share information about us. Unfortunately, we do not have a very big marketing budget. So we rely on a lot of word of mouth marketing. We're a very small team. We only have 4 staff, 2 full-time and 2 part-time. But we cover more than 500,000 square miles and a population of 70 million people. So this is a big reason why I'm here talking to you today. Each of you has the power to help so many more people by sharing our mission with your patients and medical or hospital networks. A study was done by another volunteer pilot organization, and they found that only 5% of those with a need for our service are actually being helped by organizations like ours. And the reason for that is they just don't know that we exist. So we're in need of exposure and awareness, because really the more people that are aware of this free service, the more passengers we can help, the more kids like Aiden can get to treatment without their parents worrying even more about their finances. As a community organization, you really have the ability to help us share our mission with everyone you come in contact with. Your networks of social workers, hospitals, case managers, they can greatly increase the awareness of our service. So you can find information about us online. Our website is a wealth of information. It's also where you can go to complete that application for the passengers. Our 800 number is a fantastic way to get a hold of our mission coordinators. They work 9 a.m. to 5 p.m. Monday through Friday. They also work on call on the weekends when we have flights going, but we try to not have them answer too many informational calls just to provide some of that work-life balance. You can find us on social media. That is a great way to share about LifeLine Pilots, just personally and professionally. So please find us on Facebook, find us on Instagram, on LinkedIn, like our pages, share our posts. It's really a great way for you to let your networks know about this service, because you never know who in your network might need our help. So I want to thank you for letting me share about LifeLine Pilots today. I know we have quite a bit of time for questions, and I wanted to leave that open because I know when I talk to groups like yours, it's often the questions that come up as you're hearing me speak that really help you to figure out how you can connect your work with what we can do. I just want to also reiterate that there is never a cost for anyone to fly with us. We do not require anything about insurance or a tax or a deductible or anything like that. It is just free for them to use our service. We receive no government funding. Instead, we rely on grant applications and public and private donations. So it's easy for someone to fly with us, and we're never going to ask them to help contribute in any way. So I'd like to answer any questions that we might have now. And maybe Allie can help me to figure this out.
Yeah, absolutely. So have your services ever been used to transport someone to treatment for substance use disorder?
So we have, it kind of depends if they need to get there immediately or if they can wait for us to be able to get their referral from the doctor and get the flight booked for them. So that's probably the biggest barrier for us helping someone with substance abuse, because I know often they do need help right away.
Again, if anybody wants to submit other questions, we did have some questions submitted, Lindsey, but you answered them over the course of your presentation. So that was really handy. But if anybody has any questions they want to submit, again, hover your mouse either at the bottom or top of your screen. Some options should pop up. You can use the Q&A, you can use the chat, or if you'd like to verbally ask a question, you can use the raise hand function and we will unmute your line. In the meantime, I just sent out, hopefully to everyone through the chat, our SurveyMonkey link for that 60-second post survey. Please do fill that out. We greatly appreciate it. It's what helps us get the funding to have the Lunch and Learn programs. We'll go ahead and leave the line open for just, and I see here we do have another question. Can pilots who wish to join you go online or contact you by phone?
That's a great question. So our pilot application is also online. So if you know a pilot within our 10-state region in the Midwest or kind of on the periphery, please share our information with them. They can find all the information and the required documents just through, you go on our website, lifelinepilots.org, and click on the pilot link. And that's where the application is. But if you know a pilot anywhere else in the United States outside of our region, please encourage them to find the volunteer pilot organization near them, because there are organizations throughout the country and we're all looking for pilots who are able to volunteer for us. I'm also going to share, we are trying to gather information from health professionals and anyone who has any connection with LifeLine Pilots. And so we just launched a survey today. So I'm going to share that through the chat too. And we would really appreciate your feedback as health professionals in Indiana to find ways that we can better serve your community. I will also share with Tina when we're done here information about LifeLine Pilots with our kind of a frequently asked question document and our RAT card that will provide additional information and just be kind of a reminder for you. And you can share that within your networks. Also within your own hospital or medical networks or systems, if you would like me to speak to your staff at a staff meeting, I can tailor my presentation to fit within what your requirements are. If I can do that virtually, I would love to speak just for the first 5 or 10 minutes of a team meeting, because that's a really great way for me to be able to share information and really just get on a schedule to do that once a year with your organization, because it means that as you have that staff turnover, everybody's informed about this service, and it's something that we don't lose, from year to year, and as people transition in and out of different positions.
Excellent. Well, I'm not seeing any other questions coming on. We will go ahead and hold on the line just another minute or two if anybody's still typing. But for everybody else, thank you once again for sharing your lunch hour with us. We just very much appreciate all of your time, and certainly thank you, Lindsey, for sharing this wonderful information about your wonderful organization. I'm confident that you'll get some connections out of this call.
That's fantastic. I love being able to share about LifeLine Pilots. I think it's a wonderful service, and I just appreciate you having me, Allie, and thank you, Tina, for organizing this and just sharing my information throughout your network. It's been fantastic.
Absolutely. Well, thank you, everybody, and have a wonderful day.
Thanks, everyone.